As the coronavirus vaccinations continue across Missouri, we've been listening to the questions that you have on the rollout. Thanks for joining us tonight at 6:30. I'm Deborah Kendrick.
And I'm Lucas Geisler. We're taking the next half hour to discuss your most asked questions with local health officials on vaccination distribution and the qualifications needed for the vaccine. Tonight, we're covering teacher prioritization in Missouri's vaccine rollout, how the federal to local vaccine distribution is going right now, and how recent winter weather conditions may have impacted distribution.
And tonight we are expecting Dr. Randall Williams to join us. He is not with us as of right now, but we are expecting him to Commissioner Margie Van Dieven from the State Board of Education and Head of Pharmacy Denny Hamilton with Capital Region Medical Center. Thanks for joining us tonight. We appreciate it.
Thank you.
And Commissioner, this is going to be for you tonight. What are the conversations that you've been having with Dr. Williams in regards to teacher vaccinations? We've received a lot of your questions about this, including some teachers who are wondering if they're going to be possibly, boosted up into the current eligible tier. What have those conversations been like with Dr. Williams?
We've had a number of conversations with Dr. Williams and others in the Department of Health about how this rollout would occur. And while I know we're all very, very eager to get our teachers vaccinated, we also understand the prioritization of making sure those who are highest risk receive those first. So very, very eager for the supply to catch up and for the availability to vaccinate our teachers quickly. And so conversations have gone well, and they're very, very aware of the desire to have our teachers vaccinated, and yet also responsive to the needs of the highest risk in this particular situation.
Commissioner, what sort of resources can your department provide teachers who are worried about this? The latest timeline that we've heard from the state was that possibly in April, when Tier 3 might begin, which includes K through 12 teachers, it's coming up near the end of the school year at that point. Is there any help that you can provide to teachers worried that they won't get it in time for the school year?
Yeah, I think, the most important thing is to say thank you to our teachers. Our teachers, about 98% of our districts do have some form of in-person learning. So many of our teachers have been in the classrooms since August. And what we're discovering is when the mitigation strategies are in place, there is limited transmission within our school walls. And that's really, really important for everyone to understand. So what can we provide them in the meantime? Again, the vaccine is a mitigation strategy, but there are others. We've been providing and distributing millions of masks across the state. There's rapid antigen testing that we have been working with, to, making sure that we're always giving the best information and the most up-to-speed information on what are some of the mitigation strategies for social distancing, for example. So the cohorting of students, the proper hygiene, making sure that we're communicating with parents and with teachers the importance of staying home when you're sick. So while, again, eager to receive that vaccine, it is one of many mitigation strategies, and the CDC just came out with guidance on Friday supporting that. Based on everything that they've been studying, it is not a prerequisite for a return to the classroom. And as I've mentioned, we've been doing it successfully since early fall in many cases. So, but our safety is most important for our teachers.
Thank you.
Sure. Commissioner, we actually just did a story earlier tonight about a nearby state, Illinois, and they've really prioritized their teachers to get vaccinated as soon as possible. Are you looking at some other states nearby and seeing kind of how they're doing things, and those conversations have been going with their state health directors?
Yeah, and I haven't been speaking with the other health directors, let me clarify that, but I certainly am on almost weekly calls with my counterparts across the nation, and it's about split. It's about 50-50, where teachers are in that prioritization. Many have done it like Missouri. Most of our bordering states are at least administering to some teachers, so I think that has raised additional questions. Again, Missouri has selected as its North Star serving those who have been determined as highest risk first. And what we like to continue to remind our teachers is that if they are in that high risk category, go get your vaccine right now. So there are some teachers who are included in that category. And, again, eager for that supply to increase. And that's something you're hearing from my counterparts across the entire nation.
Yeah, right now, 65 and older and those with certain medical conditions certainly could go get a vaccination right now. We also asked Congresswoman Vicky Hartzler, who was a former school teacher herself, her thoughts on if teachers should move up on the vaccine priority list. Here's what she had to say.
Well, I believe teachers need to be in the classroom, and we need to get our kids back to school. I mean, all of the data shows that kids can be there safely, as well as teachers. Children don't transmit the virus as easily or contract it. In fact, there's only a 1 in 1 millionth chance that a child will pass away due to COVID, but sadly, they're 10 times more likely to pass away through suicide. And so I'm very concerned about the mental health concerns with our children. I'm concerned about their lack of learning, concerned about the lack of meals that they're getting, not getting by not being in the classroom, and I'm concerned for the over 1 million American mothers who have had to drop out of the workforce in order to be home with their kids. So we need to do everything possible to make sure that those kids can be back in the classroom, and I still think it's up to the local state officials and health officials to determine the priority levels. Certainly teachers who are over 65 could qualify right now to get a vaccine. So the main point is that children are less likely to transmit the disease, and so I think teachers can be there safely, and they should be there.
And this question is for Mr. Denny Hamilton. When we're at the point where we can vaccinate more people and we can use, more people in these mass vaccination sites and even schools, possibly getting involved in this to be used as mass vaccination sites, have you had any sort of plan with some local districts in your area when it comes to possibly doing mass vaccinations?
Yes, we have. We've actually met in particular with the Jefferson City Public Schools system, as well as some parochial schools in the Jefferson City area, concentrating on really just knowing that we don't have the ability to vaccinate that group just yet, but making preparations for when we are able to, setting up mass vaccination clinics, whether it be in a off-site location in the community, or maybe even in one of the schools. So we are having those conversations. They're going good. Preparations are in place.
All right, we do want to welcome on at this point right now Dr. Randall Williams as well, the State Health Director. Appreciate you joining us here. The topic right now is about teacher vaccinations. Dr. Williams, I know you addressed this earlier today, so I just want to ask you again here. Can we expect teachers to move up into a higher tier in the current vaccination plan? Dr. Williams, I think you're muted right now. If you don't mind checking to unmute.
Yeah.
Beautiful.
Thank you.
Yes.
As the son of a sixth grade public school teacher who raised me, incredibly appreciative of what our teachers do. I think our intent is to try to get as much vaccine into Missouri so that we can move into our other tiers as quickly as we can. We are optimistic about that with the J&J emergency use authorization next Friday. We will work next weekend to actualize the order and expect from conversations with General Perna and the White House to get more J&J vaccine next week, the week after that. We're up to 120,000 doses of the Moderna and Pfizer, which is 40,000 more than we were getting 2 weeks ago. So I think that the quickest way to get teachers vaccinated, remembering that in many states in which they're eligible, they're competing against 2 million other people for vaccines, that I think the quickest way to get to where we all would love to be is to get more vaccine in Missouri, which we think is imminent, and then move into our other tiers.
Okay, Dr. Williams, thank you so much for that. And don't go anywhere, everyone. We'll take a look at how the vaccine rollout is doing in mid-Missouri and the impacts that weather may have had on its progress. That's coming up next. Stay with us.
Welcome back, everyone. If you're just joining us, we're speaking with local health experts tonight on the coronavirus vaccine and your most asked questions on its rollout.
We're turning our discussion now to how the rollout is working so far from a federal to a local level. Now, this question is for Congresswoman Vicky Hartzler. Now, we asked the Congresswoman, in what singular area do you think the federal, state, and local governments need the most focus and coordination in getting vaccines into the arms of Missourians? And here's what she had to say.
Well, I think we need more production capability. We have purchased, as a nation, 600 million doses. That's enough for 300 million Americans to have both a first and second dose. And yet we've only had 55 million doses go out so far. I know they're producing them as fast as possible. The Biden administration yesterday announced that they believe their capacity would increase, that they can increase the amount of vaccines going out to the states. From what I understand, Missouri has been receiving about 76,000 doses per week. And they've been doing a valiant job getting them out to the local communities. 53% of those have been going through our hospitals, which I've been visiting, and those sites are going well. We have another 25% going out and being administered through the National Guard. And then 8% just by your local providers and the federally qualified health centers. So we have a plan in place. We just need to increase the amount of doses.
So you heard Congresswoman Hartzler talk about that hospital allocation plan that has started a few weeks ago. This question will be for Dennis Hamilton over at Capital Region Medical Center. And then I'm interested to hear from Dr. Williams afterwards too. Mr. Hamilton, how is that program going? How's it been working the last few weeks?
You know, it's in central Missouri, at least in the Troop F area for Highway Patrol Troop F, we've been very pleased with it, honestly. We've divided Troop F up into two groups, the North Group and the South Group. University and the hospitals kind of handle the North Group 1 week, and then we get our vaccines in the South area of the troop the other week, and work very closely with other hospitals, county health departments, and physicians' offices to redistribute the vaccine and ensure that it's getting used within a timely manner. So we're doing our best, and I think from our perspective, things have gone rather well.
Dr. Williams, what have you heard about this program so far a few weeks into it?
Well, it's actually what I've seen. I was at Truman yesterday with Rob Nodell, the governor's deputy chief of staff, where they did 1,300 vaccines, did 2,100 a day. Charlie called us and told us. And then, last Saturday I was up at the University of Missouri where they did 2,000 vaccines in a day. So we think it's been incredibly successful. As you know, we allotted 53% of our vaccine. We're now up to 123,000 vaccines a week because they are so adept at distributing it and getting shots in arms. It's really impressive. When I was in Kansas City yesterday, and like I said, at Columbia last week. So I hope everybody in your audience will get a chance to at least to see them in action. It's really inspiring to see them bringing all their personnel and all their resources. Moon Choi was there to bear. It's really an incredibly celebratory type thing to watch, especially on that scale of 2,000 people.
And Dr. Williams, I know this was discussed earlier this afternoon as well, talking about the recent winter weather that we've been having, and we're seeing a lot of these mass vaccination clinics get canceled. How far behind, if we are, how far behind is this really, affecting the vaccination process?
It's really not. I mean, I'm thankful to say that on Thursday. I'm not sure I'd have said that on Monday. We had built in with our National Guard our contingency that it's Missouri in February. Nobody should be real surprised if you're going to have severe weather. And so we had built that in, some redundancy. So as you know, we took vaccine and distributed it to other areas in those regions, some of the smaller hospitals who hadn't gotten it. So that worked out well. We had a little bit of a constraint with just UPS and Federal Express getting vaccine, but we feel like we've accommodated that. So we'll build that out next week, getting those second doses that may not have get administered. But I have to tell you, I got a call early this morning, about 6 o'clock, from University of Missouri, and I find it amazing. But they've had almost 100% of their people this week come in for vaccines, almost 100. And these were second doses. So it's pretty remarkable.
Dr. Williams, are you aware, have you gotten any reports of, because of these cancellations, have any doses gone to waste as a result?
You know, we looked at that this morning, and as of yet, no. If you look at the universe of almost 1 million vaccines, the amount, and we have to keep up with everything that's wasted, it is literally less than 1,000. And so, to your point, at this specific period of time, the answer is no, we haven't.
I do want to circle back for just a second to Commissioner Van Dieven. When we talk about this rollout, as this expands a little bit further, are schools going to play a role at all? Will schools be host to vaccination sites?
They will absolutely play a role. I met with a group of superintendents from across the state today, and the biggest thing that we're talking about right now is exactly what you just referenced with Dennis just a few minutes ago. Getting ready to mobilize quickly is essential, and they're making those plans and working with either the hospitals, local health officials. In some cases, they may be hosting it on site, but putting together their plans and being ready for that call. As has been stated, our teachers are eager to receive that vaccine. And when I say teachers, we're talking about the education system. It takes them all to run that school, and they're ready to go. So that's today the active role that they're playing. And we also have our school nurses who are helping to administer the vaccine. So there's a lot of roles that they can play, and I think they're doing it quite well.
Okay, Commissioner, thank you so much for that. And we'll be right back with some more weather and more on this discussion after the break.
If you're just joining us, we're speaking with local health experts tonight on the coronavirus vaccine rollout.
We want to turn our focus now to the impacts of a new vaccine hitting the market soon and CDC guidelines for those that are already vaccinated. And this question will start with Denny Hamilton. Has Capital Region Medical Center figured out its plans once Johnson & Johnson's vaccine gets approved? Of course, just being that only one vaccine needed, one dose.
Yeah, we're patiently anticipating UA to get approved hopefully next week. And when it does, we'll go through the normal stages we have with the Pfizer vaccine, the Moderna vaccine, and ensure that everyone's kind of aware of the logistics behind it, which are much easier than what we've been dealing with so far. But we're excited. Any additional vaccines, whether it be by another manufacturer or current manufacturers increasing the number is going to be a good thing for the community.
I want to turn to the CDC recommendations on those who are vaccinated not needing a quarantine in some situations. Dr. Williams, if you get the vaccine and still are exposed to the virus or test positive or exposed to the virus, are you not contagious anymore? Do you agree with those recommendations? You don't got to quarantine?
Lucas, it's a great question. And so, the CDC put out last week that 14 days after you receive the second vaccination in this, and we think it'll be true for the J&J after the first vaccination, that if you are identified as a close contact, you don't have to quarantine. So we think that is a great incentive, in addition to others, to getting the vaccine. And the reason is that we believe those people who've been vaccinated have a much decreased viral load in their nasopharyngeal cavity, and that they are less likely to be infectious. So that's really where those recommendations come from. So very exciting news, very welcome news.
Dr. Williams, thank you very much for the insight there. And thanks to all three of our guests, including Education Commissioner Margie Van Dieven as well, for joining us too. Thank you very much for your time tonight.
Have a great night, everyone.
Thank you.
Thank you.